With a vaccine that could finally put an end to the global pandemic already in transit, states across the country are rolling out their plans to distribute it.
The first vaccines directly being delivered from Pfizer will go to 3 tiers in 6 regions in the state.
Will be dedicated to hospitals and healthcare workers in the 50 counties with the highest death rates per capita.
Sites were chosen because they were large enough to handle the minimum pallet or size of the Pfizer vaccine that shipped.
From giant shipments to ultra cold storage, there's no doubt the first COVID vaccine from Pfizer comes with immense challenges.
We've never had vaccine like that. So our states, our providers, our hospitals, our healthcare systems, they're not used to doing anything like that with a vaccine. So that's a complication.
But Claire Hannon with the Association of Immunization Managers says their organization has been a brainstorming platform with states joining forces, talking through innovative and creative ways to get vaccine doses into the arms of hundreds of millions of Americans. Spotlight on America found a variety of strategies in the rollout plans nationwide as states look to handle everything from rural access to logistics. In Tennessee, they've designated at least 2 vaccination sites in every county to provide equal access. Ohio's Department of Health has plans to order 15,000 pounds of dry ice per week to support hospitals without ultra-cold freezers. And in Arizona, the state has been practicing a drive-through rollout where healthcare workers get their shot behind the wheel.
We don't want vaccine to sit on the shelf. So there may be some inconsistencies across states in the response, but I think that the general idea, the concepts will be similar, and there will be consistency as far as the availability of the vaccine for everybody.
We don't want to be the last of the last.
Pat Scow with the National Rural Health Association is fighting to make sure rural communities aren't left behind. Regional sharing is one likely solution, she says, where large quantities of the vaccine are sent to one place, split up, and then shipped out to the far reaches. Scow wants to ensure access to even the most remote areas, balancing concerns about cost for struggling rural systems, whose budgets and staff are already stretched thin.
Not only you're going to roll out the vaccine and administer it and track it and report it, you're still dealing with testing people, you're still taking care of people. And so it will be strapped, probably no different than the urban areas.
But Scow says rural areas will have to advocate for their communities to get their fair share of doses and make meticulous plans about how to distribute them most effectively.
Plan a perfect picture. I don't know if we can do that, but we're going to do our darn best.
I'm Josie Sturman for Spotlight on America.